Today I would like to talk to you about neck problems. Perhaps you're having chronic neck pain, or you're having numbness and tingling in your arms and your shoulders are bothering you, or maybe you're getting ringing in the ears and you're just fatigued and run down. You might be hearing noises in your neck, or you might feel like you're getting degenerative arthritis. It could be resulting in headaches. These are very, very common problems. And so this is Dr. Ron Simms with Back to Health Chiropractic, and I'd like to dive in a little bit deeper with you on this topic. Now, what we're seeing in today's society, being in practice 28 years, what I'm seeing now I wasn't seeing back then, and that is a new condition called tech neck. Tech neck could be from too much time on your laptop, too much time on your iPad, or simply looking down at your phone too much. I was at dinner the other night. I looked over at a family. They were all looking down, and I see kids now with humps on their upper back. And ultimately, these things can lead to all kinds of problems. Ultimately, can lead to things like herniated discs or bulging discs. And so, before I go deeper into this, I want to explain something to you about symptoms, because far too often, people enter into our clinic when the pain has already been there for a while. And what I want you to understand is that being pain-free is no closer to optimum health than it is to premature death. Being pain-free does not equate to, or is not synonymous with, optimum health. So it's important you know that as we go deeper into this, that pain is always the last thing to show up and usually the first thing to go away in your recovery. So it's important you know that as we talk about these symptoms going forward. And symptoms always tell you what direction you're headed in. And so one thing we always say in our offices is we try to teach our patients to focus more on function versus feelings. Feelings are far too unpredictable. They're transient and they're not reliable. And our society has taught us to think that way, but I want you to think about it differently. I want you to think about function. And so when we look at the nervous system, there's three parts to our nervous system. There's a portion called the motor nerves. The motor nerves are the ones that control your muscles. Every spinal vertebrae between them is a nerve, one on the right, one on the left. And inside that nerve is a portion called the motor nerve that goes to your muscles. Every muscle in your body relies on nerve energy to function. If you were to cut the nerve energy, the muscle would not function. It would actually atrophy and die. It'd be like having a beautiful chandelier in your dining room with no electricity to it. The other side of the nerve, one other side is called the autonomic nerves. Think about automatic functions in your body when you hear that term autonomic. And the autonomic nervous system is the part of our nervous system that we think the least about until something's going wrong, because it affects things like swallowing, it affects talking, it affects upper immunity and digestion, and all those things we don't think about. Another part of that I want you to know is it also has to do with, there's two sides in that nervous system. One side is called sympathetic, the other is called parasympathetic. They're both very important to us. Sympathetic is that fight-flight response. It might be that you're running from trouble, or that somebody cut you off on the freeway and your heart rate went up and you're in a stress mode. And then the other side is what we call rest, digest, repair, regenerate. At its extreme would be extreme laziness. And so we talk about the autonomic having two sides to it. And then the third part of the nerve is called the sensory nerve. This is where the pain comes from. And this is the smallest part of the nerve. You should know anatomically the sensory nerves make up less than 10% of the nerve. It's a very small portion of the nerve. And if you think about how your body works, think about all the muscles you use to walk in and out of your office or to walk from your car into the market. You don't think about every step you take. And you think about eating that steak. You're not telling your stomach to digest it. It does it for you. And so you think about all that goes on in your body, it would make sense to you then that the majority of our nerves are dedicated to these functions. And that's why the sensory is very small. Now, sensory would be pain, pleasure, awareness of where you are in the environment that you're on. We call that proprioception. Feelings of hot and cold. Those are all the sensory nerves, and that's where pain comes from. Now, as we go further into this conversation, I want you to understand that in our practices, we operate from certain premises that we know to be true, and they've been proven in the trenches in our clinics over a period of decades. And the first premise is that healthy is normal. I think far too often we think unhealthy is normal because so many Americans are unhealthy. We are a very unhealthy society. We are 38th in the world as it relates to quality of health outcomes. Yet we spend the most money, by the way. We spend over $7,000 per American per year on health costs. But just remember, you were born healthy, and healthy is normal. The other thing I want you to know is that your body is smart. You think about the things that go on every day in your body. What your body's doing is smart. If you ever had a paper cut, 3-4 days goes by and you look down, that paper cut is gone. Was it the Neosporin you put on there? Was it the Band-Aid? And those things maybe helped and oxygen helped, but inside your body is the power to heal itself, and your body does that for you all the time. It's amazing. So just remember, your body is smart. The third thing I want you to know is your nervous system is the master system in your body. It was the first system that formed in your mother's womb, and it controls us from the inside out. Remember, health is an inside-out job, yet too many of us think of it as an outside-in thing, where we take pills for a thing, or we get a shot, and we do all these outside-in things, and the reality is health is from the inside out. The other thing we always say in here is that your spine is your suit of armor. Your spine is amazing. Think about all the things that your spine allows you to do. Just moving, bending, lifting, all the things we do day to day, our spine is allowing us to do that. Our spine dictates our posture. Our spine is our suit of armor, and it is a series of vertebrae stacked on each other, right? There's 24 movable segments, not to include the head and the sacrum, which is your lower bone, but there's a lot of segments in there, and you can have misalignments in there and not even know it. Remember what I said earlier? Only 10% of your nerves deal with pain, so you may not know it's there. And so think of your spine as your suit of armor. Take better care of your spine. We don't take good care of our spines in this society. We neglect them. And you see the posture of children today, and you see it being neglected in homes where parents don't really talk about it anymore. And then the last premise that we operate on is that modern life is unnaturally stressful. Okay? And so let's dive into this whole stress word now that I brought it up. Think of stress as being 3 different categories. We often use the terms traumas, toxins, and thoughts. Traumas can be, that's more of that physical stress. And think about traumas as being macro and micro. Macro would be about, like, let's say I'm sitting at a stop sign, minding my own business, and all of a sudden I hear that dreaded noise of brakes skidding behind me. And whammo, there you go, rear-ended, macro trauma. Or I'm coming off a ladder after trimming a bush, and I miss that darn last step, and into a barrel roll I go. We call those macro traumas. Far worse often is these micro traumas from bad habits. I mentioned it earlier, tech neck, where we're looking like that and we're looking down, where you start seeing that hump in somebody's back, and that they get that forward head posture, that slumping posture. And so that would be called micro trauma. Doing the same bad habits day in and day out over time becomes traumatic to your body. It leads to arthritis and spinal disease. And so when you get a little bit of both, macro and micro, it can be really bad. And I know many of you have experienced that. I've experienced that, and it's not fun. And then we talked about toxins, our diet, what we eat, what we put into our body, the air we breathe. Around here lately, we've had a lot of fires. The air quality is really poor. And so I'm breathing in all these toxins, and my body, my skin, my kidney, my liver are all trying to detox my body. But yet most people we meet, they come into our office and they're in this toxic state, which means they're in pain, they're irritated, their body's not healing very fast, and they're just not feeling good. They're not their self. And that, again, that could be you. And then that third category I talked about of stress is what we call thoughts, our mindset, our attitude. Do you have an attitude of gratitude? Are you thankful for the things in your life? Are you always complaining? Are you always whining about things? Are you always living from a place of negativity? Or are you living from a place of positivity? So just understand, traumas, toxins, and thoughts can play a big role in your overall health. And it really does affect today's topic, your neck. We see people carrying, they always say, Doc, I carry my stress up here. I get that all the time. All that tension, Doc, I feel like I'm carrying the weight of the world on my shoulders. So let me talk into that a little bit. And I'm going to turn sideways to the camera just to explain something to you. Okay, now I have relatively good posture. I see the chiropractor weekly. I do spinal exercises. I try to keep my body in balance. I do love my smartphone too, and I do spend time on my laptop. So I'm guilty of some of those stressors. But let me show you something. If I'm looking straight ahead, you follow me? For every 1 inch that my head goes forward, it doubles in weight. Most people we meet now are 2 inches forward. So if that's the case, you can take your 12 to 15 pound head and now it's behaving like a 30 to 40 pound head. What does that mean to my neck discs? What does that mean to my muscles, my upper back muscles? They're holding like tension wires. And so just remember, for every inch that your head goes forward with this tech neck, it's doubling in weight, and it's probably the reason why you're exhausted, because your muscles can never rest. They're too busy acting like tension wires, holding you back. Okay? And so these little stresses lead to a condition called subluxation. And you'll hear that in a chiropractor's office. It's a big term for us. It is a fancy term describing any disconnect between your brain and your body, which in our context is a misaligned spinal bone. When those vertebrae get out of position, like I said earlier, you may not know it. It may not hurt yet. Pain's the last thing to show up. But these misalignments lead to eventually muscle tension, muscle injury, joint misalignment, nerve tension, even nerve pinching. Now, if you pinch a nerve, you're going to feel that. But if you really pinch a nerve, but if you just irritate a nerve a little bit, you may not feel the pain. You might only have a tight muscle, or you might only have a dry throat. It really depends on how bad that misalignment is. One thing that also happens from this, excuse me, is when you lose alignment of a vertebrae, there is a very, very important mechanism that goes away. And it's the same mechanism that will help prevent arthritis. And that is a process called imbibition. Imbibition is when fluid is pumped into your intervertebral discs. Those are those shock-absorbing spacers in between each and every vertebrae. These spacers are critical. The reason they're critical is for many reasons. One is they create space between the vertebrae. That's important because that space allows for the nerves to come off the spinal cord and go to where they need to go without interference. That's what you need. You don't want your nerves to be interfered with. Imbibition, that motion, it allows for fluid to go into the disc. The disc needs that fluid, but it doesn't get it directly. It gets it indirectly through motion. So if you're subluxated, you're not getting it. And that's why we always teach our patients that a subluxation that does not get corrected will lead to arthritis 100% of the time, because the disc cannot function right when it's starved. It's just like you. If you starve yourself, you're not going to function very well. If you do that to your disc, it's going to wear out, it's going to herniate, it's going to bulge, and ultimately the vertebrae are going to fuse together. Then you're in big trouble. And that will lead to things like joint fixation and all that goes with that. And one last thing I want to say about subluxation before we move a little deeper into this is one thing that we see with this as well is it creates an elevated stress response. Let me dive into that a little bit deeper. With this, you're going to be having high blood pressure, elevated heart rate, low energy, low sex drive, low mental clarity. There's a whole list of things, but other things like fear and anxiety. It even affects our body's sensitivity to insulin, and it causes our blood sugar to go up. It also causes the good cholesterol to go up and the bad to go down, and it can also lead to an immune response that's not healthy. This is a whole thing that we call adaptive physiology. And think about what that's doing to you. This adaptive physiology is a short-term thing that our body does for itself to help you get through a scary situation. It protects you. It wasn't meant for us to live in this response, but most Americans are living in this response. They're not going in and out of it. They're living in it. And that's why we see so much disease and dysfunction in our society, in particular in our practices. So again, your spine, like I said earlier, is a suit of armor. We take really good care of our teeth. We take really good care of other parts of our body, the parts that others can see, but yet many of us neglect our spine until it's too late. So let's talk a little bit about nerve supply. One more thing before we move on, and that is, remember, everything that goes on in your body goes on because your nervous system allows it to do that. And so when your spine is in proper alignment, it acts like a switchboard. And when your switchboard is in good repair and all your fuses are healthy and all the switches are switched to where they want to be, your body is going to be dynamic, you're going to feel amazing, you're going to be the best version of yourself. So you're probably asking, what do I do now? And in fact, a lot of what I said maybe described your situation. And you're probably thinking, where do I start? And so let me just give you some practical tips, things you can start doing right away. Maybe low-hanging fruit items in your life. First thing is really look at your life in the micro-trauma area and find out, are there some habits that you're doing that aren't helping you? And maybe it's you got your computer too low and you're looking down. Or maybe you need to go see the optometrist and your prescription's off and you're having to look like that. And maybe it's your ergonomics. Maybe your work site is not set up appropriately. And maybe you need to make that move to the upright workstation now. Now's the time. And perhaps you're sleeping on your stomach, or you're falling asleep on the couch, or you're just doing things that are really sabotaging your alignment and your neck. and it's really catching up to you. So I think just some of the basic stuff is really look at your alignment and your ergonomics and get on that right away. Don't procrastinate on that one. And then the second thing is we always talk about, the other thing is don't self-manipulate. Let a professional do it. We find so many of our new patients come in and they're popping their own neck and they're doing these weird movements, and yet they're afraid to see a chiropractor, but they're trying to be their own chiropractor. It never makes sense to me. And just remember, we went to school for 4 years and spent thousands of dollars, hundreds of thousands of dollars to become chiropractors to learn how to handle the spine with care and delicacy and with specificity so that our patients can get amazing health benefits from it. And so quit being your own chiropractor, and if you're having to crack your own neck, you better go see somebody right away, because that's a bad sign and that's actually dangerous. So make sure you stop that. The other thing is we always talk about in our office how many people we meet that are out of balance, and we find that you need to add specific exercises to your life. It's a combination, honestly, of stretching and strengthening. If all you do is stretch, you might get the gate to move open, but if you don't do the strengthening, the gate's not going to stay open. And so the strengthening acts like a latch that kind of holds you in place. And everybody's different, so there's not one set of exercises that's for everybody, because everybody's different. In our practices, we take a very specific, unique approach, but it really boils down to a combination of stretching certain muscles and strengthening other muscles. And once you do that, then your body can hold and maintain that posture that you're so desperately seeking. That your mom told you to put your shoulders back and stand up, and then 10 minutes later you're slouching again, because you don't have the strength and you don't have the flexibility to hold that good posture. So really go, really got to learn what you need to do. And again, we're experts at that. And then the last thing we say is make sure you keep your nervous system tuned up with specific, gentle, scientific adjustments by a licensed chiropractor. Not your neighbor, not your boyfriend. And so make sure you see a really good chiropractor and make sure you get your spine realigned. And that leads to the next question: how do I know if I'm a candidate for chiropractic? And we get that all the time. And so let me kind of speak into that a little bit, how we go about determining if you're a good candidate for chiropractic care. First thing we do, after we sit down with you and talk to you about your health history and about your current health issues and about your health goals, we have to have that conversation of where you've been, where you are, and where you want to go. And we have to find out everything about your past macro traumas, your bad habits, all that about you. We have to learn as much as we can about you and your overall health as well. I mean, there might be something systemic going on, or could be some sort of other health issue going on as well. So we really need to sit down with you and do that. But once we've done that and we've gotten to know who you are, and where you want to go, then we can carefully put together an examination process that fits your specific concerns. And that usually will have some of these following items. The first thing we do is we do core neurological testing. It's a specialized program that allows us to look at your nervous system in a really specific, unique way. And we call it the subluxation station, but it really gives us what's called a core score. Out of 100, how healthy are your nerves? We talked earlier about those motor nerves. How are they firing? And so we do a test called an electromyogram. It's measuring the amount of tension and electricity that's in those muscles along your spine. There's normals, and then there's below and above normal. So we can really see that. We can find out where you're really hot, where you're overworking, and where you're underworking. And then the next part of that is we do a rolling thermography test where we check the temperature along your spine. In a healthy spine, the temperature will be equal right to left. And that's a very, very important health test. We want to make sure that your spine is healthy and that your organ vessels and glands are healthy. And then the third test we do is called pulse wave profile, where we look at heart rate variability and skin conductance. And again, these are really important tests to tell us how well you're adapting to stress and how well your nervous system's operating as it relates to the unnatural stresses we spoke of earlier. And then the third category, or the third thing we look at, or second thing I should say, after those three tests, that core score, would be we do digital posture testing. And we look at you on a special program that we have that looks at alignment, and it tells us what eye's high, what shoulder's low, how far your head's forward. We talked about earlier about for every inch you go forward, it doubles in weight, so we can see what your real head weight is and what your effective head weight is, and that's very important information. Then we'll take you through what we call spinal palpation, where we take you through a series of movements to see how well your spine is moving. We can find those subluxations just by using our hands and running you through this palpation test. And in that, we can find out what areas are real tender in your spine. And after that, we like to watch you walk. looking at somebody's gait tells us a lot about their nervous system and their overall health. And we want to see what kind of equilibrium and balance you have, and what kind of gait you have is very, very important to us. And then once we've done that, we also add a layer of metabolic testing where we can really look at your body composition to see how healthy you are in general. And that's a very important test because, again, it helps us determine what you need. And then lastly is we'll take digital x-rays of you. And we do this on most of our patients over age 14 because you'd be surprised what we see in people that didn't know they had an old fracture, let's say. But digital x-rays are really kind of confirming everything else we've done up until that point. Now, once we've done all that, we will typically send you on your way at that time because we need to study all that. And we'll usually have you come back that day or another day, and we'll sit down and do a detailed report of findings where we'll really look at all those tests and really get to the bottom of your health issues. And at that point, we'll know if you're a candidate for chiropractic. And if you are, we will outline a very specialized care plan for you that involves adjustments, involves helping you break bad habits, and then teaching you how to strengthen your body in a way that will last you a lifetime. So all I can say in closing, I hope you got a lot out of this webinar. I know it was a lot of information, but I know for many of you, you could relate to a lot of what I said. And my last piece of advice to you is quit procrastinating. Quit popping pills. Quit trying to suppress symptoms with pills. Instead, get to the bottom and get to the root cause of your problem. This is Dr. Simms. I hope you enjoyed our webinar today. And please visit our website or give us a call and come in and consult with us. We look forward to meeting you. Have a great day.